Hey guys, Dr. Taylor Creamer here with our lovely CA here, Danielle. So this is our last installment of Spinal Stenosis Week. So if you've been tagging along, you saw an amazing success story we had with Nancy Tullier. You saw us introduce hip extension. You saw us introduce directional preference, thoracic mobility, and then our last big key component here is intra-abdominal pressure, which starts with breathing, okay? So Danielle's going to be kind of my patient here. We're going to walk you through a little bit of a breathing assessment and kind of how we can coach this and how you can take this home and hopefully help your condition. So the reason this is important is because it allows us to create stability in the lumbar spine if we're talking about lumbar stenosis. But if we're talking about cervical spine stenosis, this allows us to kind of offload the muscles that we're using to breathe up in the cervical spine, okay? So right now, Danielle is just sitting tidily. She doesn't need to use her accessory muscles of respiration. She's just going to use her diaphragm. We're having the aid of the Core 360 belt here to kind of help her feel the pressure into her stomach, and she's going to start just breathing and expanding through here, okay? We've all heard the term belly breathing, but we want to ramp that up. We actually want to breathe in our belly, of course, in the front. We want to really focus on the sides and the back, okay? So as she's sitting here, she's breathing, she's doing a good job. She's obviously been introduced to this. She's working in the office. Okay, good. She's doing great. Perfect. So she's expanding 360 degrees out through here. Now, once we start to get the breathing correct, we're going to start instilling intra-abdominal pressure in here. So what that means is that even when she's not breathing, she has pressure in her abdomen. Okay, that's created by the diaphragm descending and rising, but she can also create an isometric or kind of a steady contraction with her entire abdominal wall. Now, this isn't a brace where we're bearing down all the way because we don't need a brace at this moment. If she was about ready to deadlift, 500 pounds, she would need a full brace. But with intra-abdominal pressure, we can regulate that depending on the load that we need, depending on what we're doing. Okay, so this is a very important key component. So just to remind you, or just a little review, feel pressure going out in all three directions, in the front, in the sides, and in the back. This is going to help create stability in our lumbar spine, help make sure that those the problems that we're having in this area don't come back. Okay, thanks guys.